where does chronic pain stem from? Chronic pain is any pain that lasts longer than the expected recovery time. So typically recoveries are in the 1 to 2 week time frame. So chronic pain typically is anything that persists longer than 2 weeks. It's part of, sometimes your brain can start getting into that mode of, even after the structural damage or after the injury has healed itself, there's that anticipation of pain. And then you can start into a cycle of pain, anxiety, and then that can go on to affect your sleep. So with chronic pain, one of the things that you have to be careful about is getting used to it. So it sounds contradictory, but the one thing you don't want to have happen is where you downplay the pain, you fight, you push through it and you ignore it, but then you have it start affecting other areas of your life, whether that be you start accommodating that pain so that you're shifting the way that you walk or the way that you carry something, which then potentially leads to some other imbalance. You lift more with one side of your body than the other. So now your body, you overdevelop on one side, and then you just wear down that one side sooner than would normally happen. So one thing is to make sure that you are going to professionals, you're having things checked out. Make sure that there's not any structural problems. If there is pain, but there's nothing structurally wrong, then yes, you may have to learn some other techniques to cope with that. But the main thing is make sure there's nothing structurally wrong where you're causing further injury. So the difference between pain and chronic pain. So when there's an injury, you are going to experience pain. And there's a normal recovery time that's associated with any kind of injury. Chronic pain is anything that goes beyond that expected recovery time. Typically, recoveries are in the 1 to 4 week range. So anytime that you get beyond that, if you're dealing with pain that's been persisting for 4 weeks or more, you're probably looking at a situation where you have chronic pain. If you haven't gone to a doctor or haven't gone to a professional to have that checked out, you need to go have that checked out to avoid future problems where you may cause more issues because there is an underlying structural problem that you haven't addressed.